You're listening to Lasting Recovery. Once again, here's your host, Dr. Judy Saalinger.
Welcome back. This is Dr. Judy Saalinger here with Lasting Recovery. We're with San Diego's premier outpatient alcohol and drug treatment program. I've been working with addictions for more than 25 years, and we offer you hope and give you and your families the tools to reclaim your lives. Just want to let you know that Lasting Recovery is nationally accredited by CARF, which is the Commission on Accreditation of Rehabilitation Facilities. And we've got individualized treatment for substance use disorders, and we're located here in San Diego. We offer family education groups for the families. We offer specialized programs for women only, which is in the morning, and we offer a teen after-school program and a co-ed evening program. We've got an outpatient detoxification, so if you're having a problem with alcohol or drugs, addiction specialist, Director of our detox, Dr. Bruce Pevney, can help you to detox from the substances. We also have an award-winning psychiatrist, Dr. Kai McDonald, who's our supervising psychiatrist, named one of the top 3 psychiatrists in San Diego County by his peers. And we're with you here every Monday morning from 9 to 10 on KCEO 1000. And today we're talking about use, abuse, and addiction and what's the difference. And you can reach us here at Lasting Recovery at 858-453-4315, or visit us on our website at www.lastingrecovery.com. And I have with me today Ed Lacey, who's an international addiction consultant, and we're talking about use, abuse, and addiction. And Ed, we're talking about, the development of the adolescent brain, what it is that happens when most adults who come into treatment have been using substances since they were 12, 13, 14. I see this all the time. We take a drug and alcohol history on people, and what was the age of the first use? And I don't see anybody checking 25, 30.
Not normally, no.
No, it just doesn't happen. And so what happens then is that as the addiction progresses, what I want our driver in the car, or a woman sitting at home or driving to know is that it doesn't happen overnight.
No,
it's a progression. And as the brain gets hijacked and rewired, it's a very slow process as we're finding ourselves to be more preoccupied with the substance. We've got some early, middle, and late stage addiction processes that people go through. And sometimes, I've had women, come into treatment who've said, went to the doctor and I told him I had an alcohol problem. I thought I had an alcohol problem and I wanted to talk about it. And he asked me, well, do you drink in the morning? And they say, no. Well, you couldn't have an alcohol problem. That's late-stage alcoholism. What we want to say is that for the progression from the time that it crosses over from social use and experimentation, whether it be alcohol or any drugs, from that crossover line into the early abuse and the early addiction, it really, and then it gets to be a problem. On average, for a woman, it's about 7 to 8 years. And for a man, it's like 15 years. So they can have all this time of, again, the brain rewiring. It's like a slow growth cancer.
Sure.
And so there's problems that occur along the way that sometimes people can go ahead and take some action and solve the problem. Other times they can't hear it.
Correct. And I think that's a part about it that's so important, is that you don't see those lines you talked about. They're not so well defined that when one's going through this process, you go, oh, well, I've just moved from experimental stage to the next stage of use. It doesn't work that way.
Yes.
It's practically before you know it, you're in it.
Yes.
And that may even be, like you say, 7 years or 8 years, 10 years with incidents without, and some people don't.
Yes.
Some people don't have that big signal. I have a new friend, and I was talking to him the other day, and I asked him, well, what was your deal? He says, you know what, I just took a look at my life, and I stopped, and I went, I want to do this to my family.
Yes.
I went, oh, my God. And then there's other people who've had, 2 or 3 drunk drivings or problems in relationships with their children, and they still continue on. So what I want to say is the blurred lines are there, and like the service you're doing by this radio program is awakening people that there may, and I'm not saying that there are, but there may be things going on in your life with your use and abuse of an addiction of alcohol, drugs, pills, marijuana, what have you, that if you take a good inventory, there's an intervention can take place.
Yes.
A change can take place.
And so when we look at that, we say, well, is it a problem? So is it affecting your school? Is it affecting work? Is it affecting, your home life? Just, when I see people have come in, just for therapy over the years, and they talk about all these problems that are going on, and they don't realize that alcohol is contributing to that. And so I start talking about the alcohol, and once they take the alcohol out of the picture, the problems really decrease.
Sure.
And so what we ask people is are you aware that substance abuse is affecting, again, your school, maybe your work, or your home life? Are people fighting with you? Is somebody complaining all the time? Or are you finding yourself complaining more, or checking out more, just wanting to come home and have a drink, and that you need to have a drink before dinner or while you're cooking dinner, and then have one after, and then you find yourself, well, I just want to lay down on the couch here and go to sleep. And this is not an uncommon pattern. One of the other things is using it in hazardous situations. Sometimes people will say, well, gee, I was driving. I had one situation where a man wanted to take his teenage boys somewhere, and he was so drunk that they were embarrassed. His kids were embarrassed, and they said, Dad, you're drunk. You can't take us. And it really, got his attention. He didn't realize how scary it was for these kids to be able to get in the car with him. Also find that there's substance-related legal problems. Someone gets a DUI and they minimize it, laugh about it. Maybe they get 2 DUIs, and then they, think, well, maybe that might be getting my attention, and that could be another problem. And is it use affecting family and friends? So, in other words, is your partner tell you that I don't really want to go any place with you because you embarrass me? When you pass out, or when you get too loud when you're drinking, or that, when we go someplace and you're over there in the corner getting stoned with somebody or doing a line of cocaine, and you come out of the room and all of a sudden, you want to just, change the atmosphere in the party because you're loaded and maybe other people aren't. So we see that pattern going on with folks that then that'll bring them to the attention. They bring the person to the attention of their addiction by making an appointment, in an alcohol program.
And I think that that's important. I think, we're in 2010, and yet we are still have a social stigma associated with addictions, with substance use or abuse. And the reality is that, if we could stop and have the concern enough to ask a friend, do you think my behaviors are, or my behaviors when I use are affecting my family, or ask your wife. We still have this thing we want to stay in secret. If you have a spot on your hand, for example, you may run off to your doctor, get a skin check to see whether you have cancer or not. I mean, you will run as fast as you can go. And yet you have this spot on your soul, or your thoughts spot, and says, is my substance abuse skin? And we still want to keep that inside.
Yes, and there's that part of it that, because it's so wired into our brains, is that becomes the dominant thought. The dominant thought is that it's not that bad.
Sure.
And again, I always tell people, if you could just sort of get your brain to, if your skull was like a plexiglass, and you could see the damage that was was happening to the brain. My goodness, most people would stop, because you wouldn't take acid and keep putting it on your hands over and over again and seeing all these scabs and all these problems on your skin. You might do something differently. However, when you're doing it to your brain, you can't see it. And this becomes a problem when we talk about this dynamic of denial.
Correct.
And that's a part that stops people, because, again, it's the disease that is because of the brain chemistry changing, that you want to be around it, regardless of what's going on.
It sounds like your message is also a message of hope that says, stand up if you have a question.
Yes.
Get help if you have a question. Ask somebody if you have a question. Like even what your services you offer in Lasting Recovery, about being able to come in and it's a warm, inviting, caring atmosphere. I mean, every time I go to your installation, it's just like a wonderful place to be. But it's also a place where you can just go and get like a soul checkup and see, how am I doing? What path am I on?
Yes. How is it becoming a problem? And
or is it a problem?
Is it? Maybe it's not. Maybe there's something else that's a problem that's aggravating it.
Exactly. Instead of waiting till it is a problem, it's also a resource to go to and to ask, is it a problem?
Yes, and we have lots of times people will come in for an assessment, and that's what they want to know. Is it a problem? How bad is it? Do I need to do something about it now? Maybe I'll try some things on my own. And that's not an uncommon thing for people to do. I'll go over with them and have them look at, am I in early or middle stage? I have a little, I have a checklist thing that people can look at and really ask themselves honest questions. And there's some self-assessments that you can find on our website at lastingrecovery.com. And that we have one on alcoholism, one on women's alcoholism. We have one on prescription drug abuse and marijuana, and that you can go to our website again at lastingrecovery.com and find out if maybe there's some ways that the alcohol or drugs is becoming more of a problem than you really realize.
And I think it's important also, we started the session, we talked about the adolescent too, and if you have a son, daughter, that you even think, and I'm saying that you even think that there may be a problem, that's the time to get help. That's the time to go and ask.
Yes, it's not about waiting until the kid calls you from jail because they've been picked up for breaking into a house trying to get money to feed their heroin habit.
Sure.
I've had people do this. I had a young girl come in who had a problem with heroin, 19 years old, working part-time, college student, and tried to get her into to come into treatment. And she didn't. She met up with her old boyfriend, and the mother called me a month or two later and said, "Gee, I wish she would have come into you and done treatment because she's in jail now for 6 months to a year." And this is not uncommon. Not uncommon at all. So what we wanted you to know is that there's different patterns of use, abuse, and addiction. And one of the things that you want to ask yourself is, what is it that I want to do in my life but that I'm not going to be able to do if I keep using substances? And it's real important that you look to yourself and say, what's my motivation? What's my motivation for continuing to use? What's my motivation for stopping? And if you've tried stopping and you're not able to do that on your own, give us a call at 858-453-4315. We're San Diego's premier holistic outpatient alcohol and drug treatment program at Lasting Recovery, and I'm Dr. Judy Saalinger. I've been working with individuals and families suffering from substance abuse disorders for nearly 30 years. I've been developed a treatment program with a wonderful family program that helps you and your family members to heal some of the wounds that have been brought about by addiction. And the number one question that you always want to ask yourself is why is it that you are using alcohol and drugs, and do you want to stop using? Can you stop on your own? And if you can't, then perhaps you can give us a call at 858-453-4315, and we can help you with your problem. We've got a teen program, a women's program, and an adolescent program, and we've got an outpatient detox as well. We've also offer individual and family therapy along with that, and an aftercare program that can go for a year. And Ed, I want to come back to this for a few minutes here to talk about what our message is today is that, first of all, when we start using substances, 90% are under the age of 20.
Correct.
And the damage that can be done to that brain, that rewiring, the hijacking of the chemicals, really leads people off in a different direction. And what they need to learn is how to change the wiring through what it is that they say to themselves, what it is that their behavior is different. And that's something that a treatment program can really help people to do. I often talk about that we have to find the language of who the real person is, and what it is that they want, what are their basic needs, what is it that they want to make themselves feel safe.
And I think it's important that even if they can't answer any of those questions, that's an indicator to try to get some help, some assistance in being able to answer some of those. I couldn't. I mean, if you would have asked, I lived one day at a time when I was out there, and that's because I couldn't answer any of those questions. And that's also an indicator that the installation of hope. That's the thing I always go back to. That there are places where you can come, such as Lasting Recovery, to come and say, you know what, Judy, I couldn't answer any of your questions. Help.
And that is so important. We find that particularly when we see, somebody that's, in their 30s or 40s, the one thing that they want is what their one goal out of treatment. I want to know who I am, who I really, really am.
Sure.
And so we look at that. It's like, what are your values? What is it that you used to like to do before you ever started using substances? So sometimes people ask people, go back and for you listeners, think about what it is that you like to do when you were age 8, 9, 10, 11.
Or maybe even, first, and I must have my little side of the fence, I can feel it here. But even at that age sometimes, even they haven't experienced that yet.
Oh, yeah.
So it's not even, I sometimes fight with people and they talk about recovery. Well, some people have nothing to go back and recover, but it's to discover.
To discover who they are, yes.
And the joy of discovery and the joy of finding out, wow, check this out.
Well, there are feelings attached to some of those experiences that we had when we were young. And being able to sort of activate those, just if you've got even 30-second flash memories about some of those good things, you want to bring that up and start having more of those good feelings. You want to really look at, what your values are. Are you living those values? Right. What's your support system like? Are you feeling loved? Are you giving love? Probably not if you're using substances, because that's the only thing that's happening. That is your love. Yeah. If you're attached to your addiction, if you've got a preoccupation with symptoms of pain or sleeplessness, and you're trying to you're using prescription drugs, you've got a lack of interest in other things other than the substances, and what you want to be able to recognize here is that you may have a substance abuse problem. And today we've covered the alcohol and drug use starts in adolescence, and it's an attack on a very vulnerable brain susceptible to alcohol and drug-related stimuli. Remember Joe Camel and all of the battle there? And the reason for that was because they were marketing directly to adolescents, and some do it a little more directly than others. So don't ignore someone else's substance use problem. So if you want to seek help from others, break the no-talk rule, start asking about it, and let people know that there is help for them. And again, my name is Dr. Judy Saalinger. I'm with Lasting Recovery, an intensive outpatient program in San Diego. I want to thank you for being with us today, and I want to let you know that next week we're going to talk about the holistic treatment of substance use disorders. And really what that means is kind of some alternative, complementary types of services that really help you to recover and discover the wonderfulness of who you really and truly are. Again, we're Lasting Recovery.